Hi everyone, I'm Dr. Munawar. I would like to talk about epilepsy in pregnancy. If somebody is having an epilepsy, and this information is for all the women and their partners or their family members if you have a woman who is having epilepsy and she's pregnant. So we will cover a few topics like what does it mean if you are having epilepsy to you and your baby, and what when you think about how becoming pregnant, what would you do? And if you find out you're pregnant, what would happen, and what would happen if you're already pregnant, and what extra care you would need in pregnancy. So so what it means to have epilepsy to you and your baby. So most of the women with epilepsy, they do have straightforward pregnancies and healthy babies, and they are seizure free throughout the pregnancy. But you should continue taking your medications. This would decrease the risks of having seizures and having a healthy baby. In terms of particular risks to you, most of the women are seizure free, but because of the hormones in pregnancy, they may have more seizures in particularly when you're pregnant. Medications for pregnancy should never be discontinued or changed without consulting your healthcare professional. A very rare but serious condition called sudden unexplained death with epilepsy is common with poorly controlled epilepsy patients. So, SUDEP is more frequent if you're pregnant. In terms of baby, most of the babies have small risk of having a problem in development, but this risk is slightly higher in the women with epilepsy because of the medications. The risk also depends on the type of medications you're taking, the dosage, and usually the risk increases if you're taking more than one tablet. The most common problem with the baby linked to these medications include spina bifida, facial cleft, and heart abnormalities in baby. If you take folic acid from before you plan to get pregnant, that is about 3 months, the risk reduces. The epilepsy medications, especially of sodium valproate, has the highest risk of having problems in the baby. Well, what to think before you become pregnant and you already have an epilepsy? So you have to contact your GP or your epilepsy specialist doctor before you plan to get your pregnancy, because the specialist doctor and your GP will review your medication and then give you a higher dose of folic acid, like 5 mg, that would help and decrease the risk of having baby born with spina bifida. And sometimes your medications can be changed or sometimes added depending on your condition and the type of epilepsy you have. And now that you have found you're suddenly pregnant and you haven't planned, so if that's the thing, you have to visit your healthcare professional. You have to take 5 mg higher folic acid as early as possible, visit your GP and get prescribed, and do not stop or change your epilepsy medications unless you're advised, because the risk of SUDEP and seizures are higher in pregnancy. In terms of care, extra you will receive during pregnancy, usually you will be referred by a midwife to a hospital where your care will be under a consultant lead unit with a specialized baby care unit. You will be registered with UK Epilepsy and Pregnancy Register. In terms of advice, apart from taking high dose of folic acid, it's advised to take shallow showers than baths, because that can reduce the risk of accidents such as drowning, and try to take a lot of rest and have adequate sleep. You will have anomaly scan from head to around 18 to 24 weeks. After 24 weeks, you will have an extra growth scan, because the risk of baby having smaller baby is higher once you are on epilepsy and on medications. You will be seen by a group of specialist doctors including your GP, your neurologist, your consultant, and a specialist midwife called epilepsy midwife. Then, how about giving your birth to the baby? Your birth plan will be discussed by us and midwife around 36 weeks usually, and most of the women will be able to have a normal delivery. And cesarean section plans will be discussed at the time of delivery. You might need painkiller, pain relief medications in the labor. We avoid a medication called pethidine, which can increase the tendency of epilepsy. We will give other painkillers. The options will be discussed by you by the anesthetist. Your baby will be handled by the baby doctor, and once the baby is born, the baby will be advised to take vitamin K injection. Usually it's needed for blood to clot. The levels are usually low in the normal babies, which puts at the risk of bleeding. However, when the woman is on some anti-epileptic medications, it can further lower the vitamin K levels. So we would be giving vitamin K to your baby. After the baby is born, the seizures may be more. You might have higher tendency to have seizures and then aura. So you have to take adequate rest, and do not forget to take your medications. Because usually you get forgetful soon after that. It's not uncommon. For breastfeeding, you will be able to feed your baby, and the amount of medication that can pass through breast milk is usually so small that is not harmful. So it's considered safe to breastfeed even if you're taking epilepsy medications. I hope I tried to cover most of your concerns in terms of epilepsy. Thank you.